Inclusion for All Action Hub. Tuesday the 1st of February 2022. Zoom online. Chairperson Jonathan Phillips.
Attendance. Tatum Yip, Community Project Worker, Healthwatch Leeds. Jonathan Phillips, Board Director, Healthwatch Leeds. Gemma O'Connell, Administrative Support Worker, Healthwatch Leeds. Elaine Ray, Principal Performance and QA Officer, Leeds City Council, Adults and Health. Lily Morgan, Youth Rep and Board Director, Healthwatch Leeds. Zaira Khanum, Physical and Sensory Impairment Development Worker, Forum Central. Nina Davies, Leeds Community Healthcare. Andrew W. Barnes, Outreach Officer, Deafblind UK. Lydia Robinson, Health Improvement Specialist, Personalised Care. Saeed Ahmed, Head of Patient Experience, LYPFT. Audrey Okeafosu, CCG. Helen Butters, Communications, Insight and Involvement Team, Leeds CCG. Christina Kozlovska, Head of Patient Experience, LTHT. Laura Phillips, BSL Interpreter. Richard Jackson, BSL Interpreter. Apologies. Alison Sherry, LTHT. Bushra Javed, Volunteer and Peer Advocacy Manager, Advanet. Caroline Bamforth, Head of Diversity and Inclusion, LYPFT. Hilary Adolfson, Secretary, National Federation of the Blind. Huazio Liu, Lai Chi Red Chinese Seniors Activity Worker. John White, Lead Nurse for Patient Experience, LTHT. Karen Shakespeare, Senior Project Manager, Leeds Care Record. Carl Proud, Project Officer, Leeds Hearing and Sight Loss Service. Lara Parkinson, Leeds CCG. Mary Naylor, Chair, National Federation of the Blind. Toshil Bhatia, Service Manager, Health for All. Abbreviation list. Accessible Information Standard, AIS. Healthwatch Leeds, HWL. Leeds Hearing and Sight Loss Service, BID. Leeds City Council, LCC. Leeds Community Health, LCH. Leeds Teaching Hospital Trust, LTHT. Leeds and York Partnership Foundation Trust, LYPFT. National Federation of the Blind, NFB. NHS Leeds Clinical Commissioning Group, Leeds CCG. Team of References, TOR. Leeds Care Record, LCR. Friends and Family Test, FFT. Leeds Society for Deaf and Blind People, LSDBP. Health Access for Refugees Programme, HARP.
1. Welcome, Ground Rules and Introductions. 2. Accessible Information Standard Updates. Updates. Number 1. What progress have you made towards completing your plans since May 2021? 2. What evidence have you had of people's improved experiences? 3. What are your plans for the next 6 months? 4. Do you have any learning or good practice to share? Leeds CCG. Helen Butters, Communications, Insight and Involvement Team. Leeds CCG looked at funding the extension of the Work With Me training led by Healthwatch Leeds and developing AIS champions. Fountain Medical Practice has contacted the CCG and Healthwatch to ask for help with AIS. The CCG are looking to pilot with Fountain Medical Practice and make an AIS toolkit which can then be shared with other GP practices. BSL Best Practice Guide for Commissioners was a national project, and North of England Commissioning Support, NECS, are working with CCG on this. There are 17 recommendations setting out a national improvement for commissioners and providers. 9 out of 17 highlight the need to find and share best practice with the BSL interpreting service and has considered people's experience during COVID. NHS commissioned NECS's work on the 2022 AIS review, building on the findings from previous reviews. NECS contacted CCG to involve people in the deaf community in the piece of work. Action 1. Helen will share the report once it is out and with the Population Health Management team. Action 2. CCG will also make comms around the guidance in the report and share with the West Yorkshire comms team to share in West Yorkshire. Action 3. Helen will update members on the NECS's AIS review at the next meeting. Saeed added that LYPFT has been involved in the AIS review with NECS. NECS is looking wider than visual and hearing impairments, including mental health and learning disabilities. IFA chair to expect contact from the review team. NECS has not contacted local authority to be involved or the Third Sector Forum Central. Action 4. Helen Butters will pass on Elaine and Zyra's email to Mary from NECS. The CCG is moving into its new organisation in July. Leeds City Council. Elaine Ray, Principal Performance and QA Officer. As yet, no evidence of change from the Council update since May 2021. LCC has added members to their AIS working group in terms of contact centre, commissioners and organisational development. LCC are looking at what core things they want to do this year. One of these is to raise awareness of AIS with service users. In the next 3 months, LCC plan to measure whether service users received the communication format that they requested. LCC have found that their staff team are not accessing the interpretation and easy read service as much as they should, so are looking to investigate why that is and communicating with staff through bulletins. Looking to incorporate AIS into equality training for the independent sector. Action 5. Elaine, feedback findings at the next meeting on the 6th of April. Action 6. Elaine likes the idea of having an AIS champion and would like to incorporate that into social work services. Elaine will take this back to LCC for discussion. Jonathan added that hopefully by the end of March, BSL will be a legally recognised language in this country. We will need to look at if this changes the requirements on AIS. Action 7 will review the BSL legislation in next meeting. Leeds Community Healthcare. Nina Davies. LCH are working with Zyra and Lydia to set up a diabetes forum working group, which includes people with physical and sensory impairments. Feedback was that information needs to be accessible so people can self-manage their condition. LCH are mapping out resources across the city for diabetes prevention and self-management. LCH are wanting to look at care more holistically and what it is like for people who are living with a disability. Leeds Teaching Hospital Trust, Christina Kozłowska. The LTHT governance process around AIS is well established. LTHT AIS Group reports to the Patient Experience Subgroup. LTHT have a number of work streams in play to improve patient experience. LTHT want the information captured on the administrative system to link to the patient's clinical record so medical staff can see the record and plan care accordingly. Over the past few months, LTHT have commissioned a business analyst to cost for this system link to be made. Christina wants to add a new flag to the existing communication flags for where people are not able to use digital technology. New project underway which will allow patients to interact with the Trust through an online portal and be able to accept, cancel or rebook appointments instead of by phone. It will remain the choice of a patient if they want to receive this service. This will be implemented in phases. The first phase will start late February and March 2022. Telephone upgrade to reduce the call waiting time and improve experiences. LTHT wants to implement the option of email and text messages with patients. Set up a group for the care of people who are deaf and hard of hearing for the public and staff. This group is working on improving experience of care. LTHT are examining the training that the staff get and commissioning videos to be made specifically for the training. Leeds and Yorkshire Partnership Foundation Trust, Saeed Ahmed. Newly improved learning disability section on the Trust website, which includes AIS overview and narrative, AIS launch video, easy on the eye design information. LYPFT has continued to action, implement, audit, monitor, review and evaluate their AIS plan to scale and pace, and have also utilised internal communication platform to send out information to Trust staff. A detailed AIS report has been shared as part of their governance structures, and this aligns to the health inequalities, patient experience and executive director's portfolio. Care Director. The Trust data recording system has moved to another improvement version. Includes a demographic, person and care records section. Successfully delivered AIS training in partnership with the Leeds Hearing and Sight Loss Service to around 35 Leeds citywide colleagues. Plans for the next 6 to 12 months. Regular Care Director system meetings and alignment to digital. Work at scale and pace to look at all aspects of AIS internally and externally. Review governance and leadership required for AIS. A review of AIS is being carried out by NHS England and LYPFT are part of the review process. Continue mapping and scoping the person journey. Trust strategic plans, business continuity and service user and carer engagement with insight and feedback are aligned to ambitious targets for health inequalities, NHS long-term plan, NHS transformation programme, place-based initiatives and other alignments which are relevant to the ongoing AIS implementation at LYPFT. LYPFT requests for the following collaborative action to be considered on a citywide level. Develop and learning for staff modular approach in co-production with our citywide colleagues and partners. AIS information made available in relevant formats for service users and carers on a citywide level and other partner platforms utilising joint working protocols. Discuss experience of care and outcome measures for inclusion for all and partners. Third, as sector organisations, Zyra Canoe. As mentioned by Nina, Forum Central are working together to update diabetes service. Have a third sector sensory awareness digital inclusion working group to avoid duplication of work and work collaboratively. Zyra offered to help with reaching out to people with lived experience through connections within the third sector. Tatum added that the Leeds Sight Loss and Hearing Loss Service is involved in the AIS review.
Reflections on what we heard. Andrew has been doing some work with Mary from NECS on the AIS and mentioned a scheme that Leeds Hospital did in the original lockdown where BSL members in hospital could access the tablets. Action 8. Andrew will pass Christina's information to Mary from NECS. Elaine asked if anyone intends to make their documents automatically in Easy Read instead of translating documents into an Easy Read format. Helen explained that Leeds CCG are thinking of making Easy Read the first version of a document. Audrey explained that some people ask for the full document after receiving Easy Read, so there is a culture shift to change to that level. Christina updated that LTHT are challenging the team to make all new leaflets in Easy Read, and over time will filter out others. Saeed said that LYPFT have a picture bank that anyone can sign up for Easy Read images. Tatum asked whether AIS review would include people whose first language is not English. Helen and Saeed have mentioned this to NECS, so they will look at this in the review, but it is not clear whether it will be added to the new AIS legislation. Lily, Healthwatch Leeds Board Director and Youthwatch Rep, has summarised our findings from IFA meetings to share with the AIS review team. Use the IFA insight to influence 1. Work with me communication training, 2. GP practices accessibility. Tatum feeds back on Work With Me training that HWL and others are delivering. Staff training a key area to help with the AIS implementation. Last November we got funding from West Yorkshire Health and Care Partnership to deliver training about communication to people with sensory impairment, autism, learning disability. The target audience are frontline staff and volunteers. Healthwatch Leeds is working together with BID and Change in Advanet. All sessions are fully booked and there is still a huge demand. We are now looking for further funding to deliver tailored training for organisations that have requested it. The training is co-designed and co-delivered with lived experience and has received good feedback. Healthwatch Leeds was approached by Fountain Medical Practice to get help AIS right. Tatum has already circulated a document which summarises what people with communication needs have said about trying to access GP service. We've asked Fountain Medical Practice to consider a range of ways which people can make an appointment. Action 9. Everyone provide feedback on the communication document that Tatum recirculated by the 15th of February 2022. Action 10. Helen, ask comms team to promote Language Empire being the new provider and how to book Language Empire.
Next step. How long will it take for the AIS system upgrade to start taking effect? When can we find out from people whether their communication experiences have been improved as a result? What are the Inclusion for All Hub's next steps? There are 2 reviews that will be published soon. This may be a focus for the next meeting. The next meeting we will try to invite more people with lived experience. Action 11. It was agreed to look at the recommendations from the BSL Rapid Review at the next meeting. Action 12. Send an agenda for the next meeting in advance to allow organisations to extend the invitations to people within their organisation who would benefit from hearing the recommendations firsthand. Action 13. Helen will ask someone from NECS to attend the next meeting.